without any further delay, I want to introduce Dr. Daud. You're going to come and give our first presentation. So thank you.
Great. Thank you, Sam. Excited to see you all and welcome you all here. It's a historic kind of occasion because the last time we had a meeting was like back a few years ago. And then since then, we haven't had any live meetings, and so it's nice to see everybody here. And also those of you who are joining from home. So I think just to take a step back, it's another historic occasion, I guess, thing here is to have our colleagues from all over California. We have representatives from UC San Diego. We have Dr. Daniels and Dr. Park. We have from UC Irvine, we have Dr. Moyers and Dr. Chow. And we have Dr. Tran, which we are excited to inaugurate this UC Melanoma Consortium. This is the first live meeting for this. And I think to take a step back, we've seen historic gains in survival, like back in 2008 or 2009, the median survival from melanoma was short, as all of you know. And now we think we are over 5 years, which is, something, but obviously there's a lot of unresolved questions in our field. There's the side effects of immune therapy, which, many of you have experienced, many of you have heard of and experienced firsthand. So I think there's many questions about what needs to be done about those. There's also the big problem that not everybody responds to immunotherapy or to targeted therapy or the types that we have today. And I think the crying need is to do clinical trials, to expand clinical trials. I think I read that in the US, the participation in clinical trials is somewhere between 2 and 4%. I think it's higher at the UCs, but still, it's not where it needs to be. And we know that to make advances, you need to have clinical trial participation. We need to improve clinical trial participation. And one of our goals with the UC Melanoma and Skin Cancer Consortium is to expand clinical trials and, have the best ideas. And maybe by pooling our resources, we might be able to get more trials underway than we have right now individually at our separate centers. And also, as many of you know, while cutaneous melanoma is like a broad category, there's a lot of subtypes of melanoma, and some of those subtypes have been historically understudied, and we don't have as much information on treating them. And then outside of the standard targeted therapies for BRAF, there's other types of melanoma. There's NRAS, NF1 mutant melanoma, c-KIT mutant melanoma. There's so many other types that, again, we don't have effective therapies for today. And so I think our goal is to, expand novel clinical trials. And we think that by pooling our resources together, we might be able to do that more successfully than each of our centers are able to on its own. So I'm excited to see everybody present here. And so our program today is going to be really interesting. I think it also looks at the last couple of years of advances in melanoma, and both 2021 and 2022 have been packed with advances. There's been new studies showing the utility of pre-surgical or neoadjuvant treatment in melanoma. And Dr. Sai will talk about some of these neoadjuvant approaches, and I'm looking forward to hearing her. And then Dr. Moyers is going to talk to us about targeted therapies, looking at BRAF inhibitors and beyond. And again, there's so many questions about what the right sequence is and what the right combinations are, and what do we do beyond BRAF inhibitors, for the other subtypes of melanoma. And then at 9:50, Dr. Daniels, who's a professor in the Department of Medicine at UCSD, will talk about TIL, which is one of the exciting things that's happening in our field right now. And there's possibly some approvals coming around the corner, and also some novel TIL approaches that are underway. So I'm looking forward to hearing that. And I don't want to keep going on, but we'll break for a question and answer, and then afterwards, Dr. Tran will talk to us about sentinel lymph node biopsy and other surgical questions and controversies that are out here. And then Dr. Brownstein will talk to us about brain metastases, what are the treatment approaches? And Sam Gill will talk about patient resources. And then we'll end up with a question and answer at 11:30. So with that, I'm welcoming everybody. Dr. Sai maybe can get us started.